My name is Mike Flood. I live in Norfolk, and I was born and raised here, and started a business here in 2000, and have grown that business. I had been in the legislature before, from 2005 to 2012, and enjoyed representing the 19th legislative district, which has expanded a little since I left. It is now also includes Woodland Park, which is in Stanton County. I have a wife and two kids, ages 10 and 14, and my oldest is a football player, which I never thought I'd have because I was not an athlete, and my youngest is I don't know, he's a creative, and he's busy. He's a skateboarder, and my wife teaches school at Norfolk Public Schools, and I decided to put back in for the legislature because I started looking at what's happening in Northeast Nebraska with depopulation. We have a lot of counties around Norfolk that are rapidly, I shouldn't say rapidly, but they are seeing a decline in population. And Norfolk, since its inception, has not really ever gone backwards in population, but if less people in Pierce, Nebraska mean less people in Norfolk. And if you look at the data, it would suggest that in 2023, we're going to start seeing a decline for the first time. And that's not good for the state because Norfolk has been a strong beacon of economic health in an area off the interstate since its inception. It plays an important role in balancing our state out and being a hub for services for people from as far away as Valentine. Not only for services, but healthcare. If you have a cardiac event and you're in Atkinson, you're going to get transported for the cardiothoracic surgery to Norfolk, which will save your life. I have cardiac issues, and I don't know that I'd want to live that far away from somebody that could crack my chest open and fix, a valve if that goes south on me. And the helicopter can get them here faster. So I want to maintain and grow our community up here. And when I say community, I'm not talking about Norfolk. I'm talking about Northeast Nebraska. One of the things that I think needs to change in the way we define ourselves is, Norfolk has a responsibility to the small towns around it to make sure they're healthy. And I want to really employ kind of a regional concept, meaning that I don't focus on the largest city in my district, and I don't just focus on Battle Creek, Madison, Newman Grove, Meadow Grove, Tilden, that I also worry about, not worry, but that I also strive to find solutions for people in Pierce County and Antelope County and Knox County, because we have so much to offer the rest of the state. And I don't think sometimes we tell our stories. I mean, have you ever been to the confluence of the Niobrara and Missouri rivers, up there, or the Niobrara, if you're in Niobrara, Nebraska, and you're looking out at the confluence of those rivers, we have something that is so beautiful in Northeast Nebraska. Then if people from the region knew about it, they'd want to move there. And maybe we don't tell people because we don't want anybody to come take our spots. But, we have something to offer the state. And I also, I've been through the legislature. I enjoy the plurality of it. I enjoy getting to know the other senators of both parties and working to find solutions to problems. So there is a brief opening statement, but I'm happy to expand on anything.
Great. And good morning, and again, welcome to former State Senator and Speaker of the Legislature, Mike Flood, again, legislative candidate from District 19. Thank you, Speaker Flood, for joining us for our virtual legislative candidate meetings. My name is Gina Ragland, and I just have to interject before I introduce anyone else. I actually appreciate you mentioning Atkinson, Nebraska. I actually was born and raised in Atkinson, Nebraska, and very much appreciate your comments. Great community. Also, your comments on North Central Nebraska. Certainly there wasn't a time that we didn't very much appreciate all that Norfolk had to offer us, and Niobrara and the surrounding areas. So thank you for your comments on that. Also joining me today are Susan DeCamp, Bob Lassen, and Danny DeLong, who are AARP lead advocacy volunteers, and Dave Holmquist is our Nebraska AARP state president. Also joining us is Emily Wick with the state office as well. So
Dave,
again,
you didn't get enough of the legislature before? You wanted to sign up for this again?
Yeah, well, I retired from the American Cancer Society in September of 2016, and I became state president, which is a volunteer role, the day I retired from ACS, and I'm in my third. So they got to live with me for 2 more years, and I guess the members of the legislature, to a certain extent, do as well. It's good to see you again, Mike.
Yeah, good to see you.
yes, we snagged him and we're not letting him go until we absolutely have to. Dave is a great asset. So, so Senator, thank you again for joining us. We appreciate your time and taking the time to meet with us, especially to discuss importance issues for the 50+ voter and their families. As a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. So you gave a great background information and we appreciate that. I think we'll just now jump quickly into the questions. Again, we provided you with a set of 3 questions pertaining to the 50+ voter in Nebraska, allotting 5 minutes for each of those. So our first question will actually come from Danny DeLong, and it'll address helping people stay in their homes and communities. So go ahead, Danny.
Hi, Senator Flood.
Morning.
A livable community is one that is safe and secure, has housing that is affordable. In other words, no more than 30% of the household income is spent on housing, has transportation options that allow individuals to travel by multiple means, and has supportive community features and services for people of all ages, thereby allowing people to remain in their communities as they age. Our question: what steps will you take to ensure all Nebraskans have access to livable communities?
Well, thank you for that. I think it's important, and I'm going to give you just a little background on my answer before I give it. Since the pandemic started, you may know this, but I have a TV network that's across Nebraska. And I started a program called Quarantine Tonight, which is basically Nebraska bands that perform from 8 to 10 p.m. Weeknights on News Channel Nebraska. And I asked the viewers to let me know what bands they liked, and I've gotten 2,400 handwritten letters. And I can tell you that one of the things that I think is facing Nebraska, and this isn't it is, but it isn't a government issue, is the issue of loneliness. There's a lot of people, especially during the pandemic, and I would argue that maybe it persisted before the pandemic in a big way, that are in their homes and they're not going anywhere, and that TV becomes their conduit to the outside world. And they share with me some of the most intimate details of what they're going through in these letters. And so I've had a firsthand encounter with, I think, a demographic of the state that people in their 40s and 30s often don't get, because when I have a polka band and or the Duffy Ballarat Orchestra, and they played at their wedding in 1963. I'll get a letter from a lady in, I'm thinking of the town, Schuyler, who basically said that she lives alone, her husband passed, and the Duffy Ballarat Orchestra came on, or the Leo Lonnie Orchestra, and she got up with both of her canes and she danced for the first time since she passed, and tears were streaming down her face.
Yeah.
And it's hard to not feel for people going through that. And I love bringing that entertainment to them. And I guess my point with that is, yes, we have to have livable communities, and we do. I've supported the Affordable Housing Trust Fund. The Affordable Housing Trust Fund in Nebraska has done a good job, I think, and we're expanding our affordable housing in Norfolk. I've supported public transportation as a state senator. I really think cities advocate very well for themselves. It could always be better. I wish that the Uber apps we had more Uber drivers to get people around. I think it's fantastic. And last night, for instance, on my show, a 91-year-old retired pastor whose mother, whose grandmother started the Presbyterian Church out in the country in 1905, gave his first sermon in 1947. He showed up at the VFW last night and gave the prayer. And it was dark and it was construction on the, he parked a block away. I thought I needed to help him get to his car. He was swiping his phone. He was checking his messages. He had, at one point he said, my grandson's a police officer in Gothenburg, and he gave me this. And I thought he was going to pull out a gun, but he pulled out like a personal alarm device. And then he got to his car and he swiped the side of it and he started pushing the code to get in. 91 years old, lives alone on the farm, running around, walking through construction. And I guess it made the point to me that, don't assume that people of mature age aren't in touch with technology. I mean, I don't know if he was Snapchatting or what, but he was communicating with his daughter, who was watching him in real time give the prayer. And so, I think we have this idea that, well, you have to have housing for the older generation. You have to have, if you don't have the money for housing, you need a house, and you're all in the same boat. And we just have to make sure it's available. That said, I don't support adding any more taxes to the documentary stamp tax. I think they just gave away like $10 million out of that Affordable Housing Trust Fund, I think, for rural housing. So there's obviously some money.
Right.
Other livable things. My mom worked in home health early on in her career, and I really think that's important. We can't afford the bills that are coming our way if we move to a skilled care facility for everybody. So we have to figure out ways to keep people healthy in their homes. And quite honestly, I think the model's changing, and nothing we've done, but I think there are going to be less people in skilled care in the future. It's going to go more to this ambulatory or urgent emergency, to figuring out how to care for yourself at home, which sounds great, but what happens when you absolutely need 24-hour care? And we've lost enough nursing homes up here that I'm worried about that.
Thank you, Speaker. Our second question we'll move into now is kind of a combination of maybe some of the issues you've already started discussing, but I think it's a great segue. Susan DeCamp will take that question, and it addresses health, caregiving, and home and community-based care. So go ahead, Susan.
Good morning, Speaker Flood. Nice to have you with us. I have to quickly add that I grew up in the Antelope County area, Orchard and Neely area. And when you say that Norfolk was the hub for those smaller surrounding towns, that is exactly right. That's where we went for our healthcare needs and our big shopping days. So, and also spent a lot of times on the river, the Missouri River near Niobrara. And yes, it is beautiful. So thank you for that. My question, caregivers help older persons live independently at home by providing assistance with activities like bathing, dressing, and performing medical and nursing tasks, such as administering medication and wound care. But caregivers often provide these services with little or no training and little or no pay. So with that in mind, I have a two-part question. First, would you support helping caregivers with things such as paid leave, respite services, telehealth, and access to education and training? And secondly, how would you protect or expand paid services and supports, as well as financial security that allows more seniors to live independently in their homes and communities?
Well, both of those, thank you for the question. Both of those issues involve state tax dollars. And so as a state senator, given my prior experience, what I try to do is I try to balance the interests of health and safety with making sure that we live within our means. If we exceed our means, the taxpayers don't have the, we can't take more from everybody to do things that we're not getting good value for. And when these proposals are made, I think they need to be made with an explanation of the offset. You know, what is the value to the taxpayer to expand a service here to keep people out of a 24-hour skilled care facility? You know, right now our Medicaid reimbursement rates for nursing homes aren't keeping up with the costs of care according to a lot of the skilled care facilities. You know, I don't know what it is now. I know that you can end up paying $8,000 to $10,000 on the high end for a really nice skilled care facility, maybe $4,000 to $6,000 a month in the mid range. And I don't exactly know what the rate of reimbursement is for the state, but I can tell you $4,000 to $5,000 a month is a pretty big hit, you know, for state taxpayers. So I kind of look at it this way. And my experience, I haven't had this specific issue when I was in the legislature, but I had this issue with mental health care. We, of course, being Norfolk, have had a long relationship with the Norfolk Regional Center, and it transitioned its mentally ill patients out mostly. And the demand became, or the question came, what's the best way to keep them going in a healthy way? And because when they show up at the hospital, they end up in inpatient acute care. It's very expensive and it's very bad for them. It's a lot more dangerous when they get to that level where they're having a really manic episode or a acute issue. And what I've always thought is if somebody checked on them every day, make sure they were taking their medicine, make sure that they were tracking along with what was going on, that they weren't having any thoughts that were negative, like wanting to harm themselves. We could pick up on the clues to get them some help before it ends up in an involuntary admission to the hospital. We can get them in to see their doctor to get their medication adjusted or make sure that we're getting their meals. And the problem is, because that is a non-medical model, Medicaid won't reimburse for it. And so from a taxpayer's perspective, it's like, are we better with a little bit of tracking to make sure they're okay? Or do we just want to pay for the big stuff every time it happens? And I think we want to look at this non-medical model as long as the data shows that it's going to keep people healthier and safer and cost less in the long run. So I kind of compare this situation to that. But I think the best thing that can be done to help somebody like me is that we actually get data from a trial or a model to say, hey, we can check on folks. You know, one of the things I've thought about is we play bingo on our station twice a week, and we have mass every morning at 8 o'clock. And people say, because Father Joe is on at 8:10, my mom gets out of bed and gets going for the day. And but I think technology is going to allow us to play tic-tac-toe or to play these interactive games with people, and you can kind of sense if they're tracking along or if something's going wrong or why aren't you playing, or I think we need to use everything we can do to keep them going, so for their health. But yes, the question is, can we use a non-medical model? And I think we should definitely be exploring that. And that is at a weird intersection of the national, Medicaid rules and regulations, and then what Nebraska can do. And I think that answers your question. Paid leave, telehealth, paid services. Okay.
Yes, thank you so much.
And definitely, Senator Flood, and obviously I think AARP does a lot of research and has a lot of data on different issues. We do have a caregiving report too that comes out every year. I know you're busy. I may follow up with and send you some information on that just shows you some of the data. And obviously that you probably know better than most, but the studies show aging in place does save money in the long run. But in order to do that, we have to have the appropriate workforce or providing some kind of supports for non-paid caregivers that probably most likely are family members that are doing it in their own homes. So very much appreciate your comparison, and certainly the non-medical model I think makes sense. So thank you for your thoughts on that. Our last question now comes from Bob Lassen, and this, we've talked a little bit about nursing facilities, but directly about nursing facility quality. So go ahead, Bob.
I want to first congratulate you on setting up the show and the communication that you're having and recognizing the loneliness. And that's obviously an area that AARP works in too. But I think it's a lot worse than probably the average people understand. My question has to do with the nursing facility quality. An estimated 6,600 Nebraskans reside in one of Nebraska's 211 nursing facilities. By 2040, the University of Nebraska Omaha projects that number will more than double to almost 14,000 people. Due to a variety of factors over the past few years, Nebraska has seen an increase in nursing facilities that are closing, and the residents having to relocate to elsewhere. And you mentioned that earlier. How will you ensure that Nebraska residents receive quality nursing home care, ensuring an adequate nursing workforce, education and training, and proper reimbursement?
Well, that's a great question, and I think that you could, there's a lot of different ways to answer that. I think that what I would start out with is I don't know everything as it relates to where the demands are going to be. I will tell you, I'm concerned about the increase in Alzheimer's that's happening in America and in Nebraska and how that's going to impact us. And I think I use that as an example because you can make all the plans on capacity you want, but what kind of capacity do you actually need? And an Alzheimer's patient has different needs than somebody who's recovering from surgery on their knee and ended up in a skilled care situation for 3 months with rehab. And I think we need to understand what our population is. We need to get UNMC at the table to talk about how we're going to train the healthcare workforce. What does that look like? My gut tells me that if we do the same thing we're doing now, we're just going to run off a cliff because the reimbursements aren't matching the need. We have to use some innovative approaches to figure out how to care for this population of people that are coming, our moms and dads and sisters and brothers and all that stuff. And it has to be a mix of non-medical home care with the right kind of care for people given what the patient needs. I know that we absolutely probably cannot afford this. I found it interesting. There is a place in Norway, I think, that is a recreated city from the 1950s, and Alzheimer's patients from Norway live in this city, which is basically, it's confined. But you leave your apartment and you walk down the street, and everything you see would connect you with the era that you were born in. That you were 15 years old in, and it provides a lot of happiness to the patients, and they can never really get sideways, because everybody that works in these restaurants is also a caregiver. So, they're in a very safe place. And I know that the taxpayers can't afford that, but how do we get private business to start providing some of these services? And that's probably not the right way to do it, but, you want to balance what the taxpayers can pay with what's best for the patient. And the whole reason I know about Alzheimer's is I was reading this article and I started researching Alzheimer's, and I thought, oh my gosh, what is going on? Why are we getting so many Alzheimer's diagnoses? And I don't think anybody really knows based on what I saw a couple years ago, but we got to figure something out. Maybe it's a regional issue. Maybe it's incentivized by region to say, okay, if you are in Broken Bow, there's going to be a spot in Ord where people from the area can live. And so we aren't trying to recreate an Alzheimer's unit in every single town, and it's better than going to Omaha. But I guess to your point, I think it's a huge challenge, and I don't have the answers, and I need to find out more about what the need is, but we has to be specific to the patient.
Okay, just to kind of follow up real quick on that. The reimbursement rates, facilities are saying that they actually subsidize a Medicaid patient by about $30 a day. Do you think there's anything that we can do with the reimbursement rates to kind of help that number?
Well, I know the legislature has authorized some increases in the provider rates in the last couple of years, and the governor's signed those budgets. You know, it sounds to me like the payer mix is, you know, to be a nursing home, you've got to have a good payer mix, and doing that the right way is difficult and complicated. You know, the state you can't expect people to do things for nothing. But we also have a right to expect businesses that are providing these services to be as competent in their business as they can be to make it work. And I guess what I'd want to understand is why does the Battle Creek Community Pride Care Center thrive and what kind of payer mix do they have? I mean, to me, in my district, I look at the Community Pride Care Center in Battle Creek, and I think that is probably one of the best places to get care. That community, you know, people that care for you there are literally your neighbors, and they go out of their way to make it special. And there's a city-owned nursing home that is a bright spot. What are they doing so well in Battle Creek, and how can we do that in other towns? And then I've also had here, we had all those golden living centers that went away, and it was terrible. Our news department covered that, and yeah, people moving to Omaha, you know, which that's not where they're from.
And the transfer trauma alone, I'm sure you've heard those stories too, but you know, that's what's devastating is when they have to relocate and have a loved one who can't visit every day because of the miles in between. So very much appreciate your thoughts on that, Senator. So thank you, Senator Flood. We're now getting to the end of our meeting, and I'd like to give you the final few minutes to offer any closing thoughts or comments that you might have, or messages you want to send to any constituents in your district. So the floor is back to you.
Well, I don't have the answers to all the questions, but I have an open mind, and I'm interested in making forward progress. And along the way, let's recognize what we're doing right. I mean, we're all in this for the right reasons, and sometimes we have 1,000 things that we think need to be changed, and there's 5,000 things that are working well. And if something's working well somewhere, let's find out and lift those people up and say, tell us what we need to do here. I think we do things in this district that the rest of the state can learn from, and I know they do things in the rest of the state that we could certainly learn from, both urban and rural. So I don't want to buy into anything that's us versus Omaha. I don't want to buy into anything that is it has to be for my district or I'm not doing it. But at the end of the day, the people up here are hiring me as their representative to do the best job I can to try and make a positive change. And I'm going to do everything in my power to help them and work with my colleagues. So as it comes to your issues on the AARP side, you know, I appreciate the connection, and let's just touch base when, you know, as you go through stuff, and we'll learn more about Alzheimer's together.
Thank you again, Senator, for taking the time to visit with us. We wish you the best with your campaign. And again, thank you so much for meeting with AARP Nebraska today.
You bet. Have a good day.
Thanks, Senator.
Thank you.
Yeah, thanks so much.
Bye-bye.
Bye.